I want to give a quick update on the state of the pandemic, and then, as I mentioned, sort of the impact on UW and SPH operations. As always, our hearts go out to those who have lost loved ones or whose loved ones are currently battling COVID-19. Worldwide, there's been nearly 133 million cases, confirmed cases of COVID-19, and global deaths total more than 2.8 million. As you have probably seen in the news, we are starting to see an uptick in cases here in Washington State and also nationally. And that is obviously causing concern. The drivers of that uptick are probably twofold. They're probably related both to some loosening of social distancing restrictions and other restrictions that we've seen both here locally and across the United States, as well as the emergence and spread of new variants that are more transmissible and also in some cases lead to more severe symptoms of COVID-19 as well. And so we really have reached this point, both nationally and in the state, when we are in a race against time to try and get as many people vaccinated as possible before the variants spread more. So hopefully all of you have seen that the governor has announced that as of April 15th, that all adults in the state of Washington over the age of 16 are eligible for the vaccine. And hopefully you are also seeing pushes from City of Seattle, from Public Health Seattle and King County, from pharmacists, from UW Medicine, from other groups, from our partners, to really make vaccine as accessible as possible to as many people as possible, and particularly to try to ensure that individuals who have been hardest hit by COVID have accessibility to the vaccine. So with that, I guess I just wanted to sort of touch on what you can expect in terms of our planning at the University of Washington. So as you're probably all aware, we are now in phase 3 across the state of Washington in our reopening phases. It's worth noting that the governor, as part of that reopening plan, has said that he will reevaluate phases every 3 weeks, or 3 weeks after shifting into a new phase. And so Monday, we're expecting an announcement from the governor. We don't know whether or not we will have a return to phase 2. It probably depends upon whether or not we see additional surges in cases. But I just want people to be aware that that is one of the things that we're looking at for next week. Regardless, for spring quarter here at the University of Washington and in the School of Public Health, we are remaining predominantly online. So our classes are all online, other than limited classes, for instance, in clinical departments where in-person classwork is required. And we are allowing some limited co-curricular activities. So for instance, office hours in person, group meetings in person for small groups, and only on a voluntary basis. I want to remind people that while there was a message that came out from the central administration saying that people who want to come back can come back, they can only, there was a caveat there, which was if they can do so safely. And we are still working as a school to ensure that our facilities are ready and that we have the systems in place to be able to accommodate those folks who are non-essential workers but want to come back. So please coordinate with your department administrator if you want to come back, but you don't need to come back, so that we can start working you into that planning process. You probably have, if you're at the UW, you probably have also seen messaging coming out from Central indicating that we are really hoping to be back almost entirely in person in the fall. And I wanted to make sure that people heard loud and clear from me that that comes with a big caveat. So we absolutely are planning that. And so you will see in terms of your time schedules, if you're teaching a class or you're signing up for classes, that they're scheduled in rooms that assumes no social distancing and in-person classes. And I just want to clearly state that while that is the planning scenario that we are using, that we will only do that if that is consistent with public health guidance at the time the fall quarter starts. So if public health guidance, either Public Health Seattle and King County or Washington DOH, suggests that that is not safe, we will not do that. So I know people got really anxious when they saw that because we're clearly not ready to do that now. I actually think we're on a good trajectory, even with the variants, to get there. But I just want all of you to know that there's a lot of things that need to happen between now and then for us to get to that point. So we are planning for that, but we're also doing contingency planning and realizing that we will need to pivot if things do not get to where they need to be in order for us to return in person in the fall. So those were the main things that I wanted to cover. We are doing a bunch of listening sessions this week. We've done a couple with students already, and then we have ones coming up for faculty and staff. We want to hear from you. I want to again reinforce that we are doing everything that we can to make sure that you can return safely and that the appropriate precautions are in place. And you're going to see us sort of holding you back on returning until we get those systems in place.